came to the line of OB, the chief complaints of lower abdominal pain off and on for 6 months. Whitish vaginal discharge for 3 months.
Vaginal discharge only should be complete. Don't write out. Then you will elaborate on the vaginal discharge, right?
History of breastfeeding illness. The patient was apparently normal 6 months back. Then she developed lower abdominal pain off and on, which was increased in onset. That lady starts at left lower abdomen and leads to other side. The pain aggravates with acne. The patient complains of similar pain for the last 3 days, not in long rest. History of vaginal discharge for 3 months throughout the menstrual cycle, which was white in color, recording consistency, associated with itching, not associated with solitary discharge or bleeding. Similar history of vaginal discharge was present several back, for which she has taken homeopathic treatment. She is not sexually active for 7 days. No history of fever, nausea, vomiting, no history of bowel contents, no history of burning menstruation, dyspnea, frequency, urgency, no history of menstrual irregularities. Menstrual history. Age of menarche started 14 years. Last menstrual period from another order 24. Menstrual cycle is regular. Last 48 to 5 days, every 28 days cycle. Not associated with the class of pneumonia. Marital history 120 years of age. Obstetric history. Obstetric scores parallel to line to last childbirth 20 years ago. First pregnancy 22 years ago. Filled a normal vaginal delivery at private hospital. Delivered May 80. Birth weight 3.5 kg. Currently IVF. Second pregnancy 20 years ago. Filled a normal vaginal delivery at private hospital. Delivered female baby. Birth weight 2.75 kg. Currently IVF. Contraception history, postpartum sterilization was done. Past history, no relevant significant comorbidities present. Surgical history, open administration is done and 2020 private hospital. Family history, no history of handicapes or medical comorbidities in family. Personal and social history, her appetite is normal, diet is mixed, sleep adequately, bowel and bladder are cellular, no history of alcohol, drug abuse, multiple sexual partner.
I will be continuing with the examination part. Patient is conscious, general examination. Patient is conscious, cooperative, oriented to time, place, and person. She is moderately within knowledge. No signs of para, interest, clubbing, cirrhosis, lymphadenopathy, or edema. On examination, thyroid and breast are found to be normal. Her BMI is 21.9 kg per meter square. Her vitals are all normal. Systemic examination, cardiovascular, respiratory, and
So, what are the two important salient points in your case?
She came with lower abdominal pain on top and vaginal discharge with remorse.
Okay. What do you think? Is vaginal discharge abnormal?
No, ma'am.
So, when you call that the vaginal discharge is abnormal?
She is having throughout the menstrual cycle.
So, when the patient should have a vaginal discharge, not throughout the menstrual cycle, throughout the menstrual cycle, sometimes it will totally stop. What do you think? What is normal? Number one, it should, if it is associated with itching, then it is abnormal. So, it is not associated with itching. So, is it not abnormal? How do you say? Because this is the most common complaint in a OPD. Every female is coming, 90% of the females are coming with the complaint of abnormal vaginal discharge. Okay? So, when do you call that this vaginal discharge is abnormal? Or let me ask you in another way, you must have read in your book. Which book do you read? Lakshmi Shishadri, a very nice book. There are two types of discharges, basically physiological and pathological. Okay, when do you call this discharge as a pathological? You told one associated with itching. She doesn't have a itching. Shall we call it abnormal? Because this is a chief complaint. And madam is saying that you to complaining, this is not a complaint. So justify yourself that this vaginal discharge is abnormal. Excessive amount. When this terminology for anything excessive is being added, so what is normal? For every abnormal thing, there should be something normal. So what is that normal? Should vaginal discharge happen throughout the cycle? Yes or no? Why no? Why no? I'm just enumerating the questions for all of you, including the PG. What causes vaginal discharge? What causes vaginal moistness? What are the glands important? What are the cells which are important for the vaginal discharge? Is it different from the vaginal? This is a whole day I can take on this, but you just go back and read on this. What is abnormal vaginal discharge? How to differentiate between a vaginal and a cervical discharge? Is the cervical discharge normal? What is the difference between the cervical and the vaginal discharge? How does it changes with the menstrual cycle? How the consistency, color changes with the cycle, which is the most important hormone, which is responsible for the vaginal discharge. What it causes? What it causes? And then what is there in the lining? What is the normal common cell of the vagina? What is the normal common cell of the vagina? Is it different in the upper part and the lower part?
There will be a lactobacillus.
Yes, perfect. So every open area to the environment has a microbiome. All these cavities are covered by a microfilm. Whether it is a vagina, whether it is a urethra, whether it is your own mouth, which is the most important component. And whenever there is a disbalance in between the two, there occurs a problem of a discharge. Discharge can occur throughout the cycle. Its consistency, color changes. But if it is problematic for the patient that she has to use the pad, she has to change her undergarments, it is associated with other symptoms, then this is discharge. discharge which is abnormal. So this has to be taken in the history of vaginal discharge. Okay, so none of your complaints were like this. Okay, throughout the which was white in color, so it's okay, white in color. Sometimes it is white, sometimes it is transparent, sometimes it becomes a small curly line. So it's okay. So it should bother her that much. Then we will call this discharge as an abnormal. What is the normal vaginal pH? Yes? 3.8 to 4.5. What is the pH of the cervical discharge? What is the pH of the cervical discharge? Why? Madam, I am from some different area. I should have my own entity. So my pH should be different. And what is that pH? What is the pH of the semen? Alkaline. Cervical discharge also has got an alkaline pH. Okay, that's why all the sperm runs away from the vagina to enter inside the cervix and live there. Okay? So you got my point? Now you told this history of pain in abdomen on left lower radiates to other side. Is it associated with menstrual cycle?
No.
So not rated? No association with the menstrual cycle?
It's not associated with menstruation.
What is the characteristic of that pain?
The leaking.
Where it is written? Written? Dull aching throughout the day?
No.
Intermittent?
It's on. She gets it on and off.
So intermittent what? See, pain, you can have a fever on a pain. So you need to mention intermittent dull aching pain. Is it associated with intake of food or passage of stools?
No, it's not associated.
So that association should be asked. Is it associated with the urinary complaints? There was no urinary complaint, so that's very nice. So she has a dull aching intermittent pain. For this, does she need to have a medication? Does it relieve on medication?
No, she didn't take any medications.
So it relieves on its own.
Yeah.
Simple spasmodic pain.
Yes, it's released on its own.
Yes, get relieved also. So intestinal pain can subside also on its own. Spasmodic pain comes, goes. So how to differentiate it with your pelvic pain? You made first diagnosis of chronic pelvic pain. So chronic pelvic pain is totally different entity. This is for you people. That is totally different entity. Okay? So this you have. So now go. Okay. So she is not sexually active for 7 years. Why?
She said she's not active in 7 years.
She is 44-year-old female, lightheaded and not active since the age of 35. Husband alive, not alive.
Husband is alive, but she's not active.
So now you see the diagnosis I can change very nicely. That she has some psychiatric problem. If you cannot elaborate on that. Got my point? Every complaint should pinch in your mind. Why is it so? Is it normal thing for a married couple? No. So either she is having a dysmenorrhea. That is why she is not going for it. Or her husband is having a problem. Or she is having some problem. So there now my diagnosis changes totally, and that is why now she has come with some of the symptoms. The discharge is not important, even the pain is not that significant. Okay? So this history should be elaborated very nicely. Go further. There is no history of menstrual irregularity. PID generally associated with menstrual complaint, heavy menstrual bleeding, intermenstrual bleeding. She doesn't have that. Okay. Next. Postpartum sterilization. Okay, this was okay. Okay. So now this is the patient which has come to you. How will you go about it? What investigations?
Ma'am, we will do blood tests.
For what? Pain?
Yes, CRP.
Why CRP?
Infection, inflammation.
That is a very non-specific marker. Please, I request you all don't go for a CRP. It is a totally non-specific test. Don't go for it. Now, what else? What for ESR?
Inflammation. So ESR
will be raised. Rather, I would like to go for a CBC for these type of patient who diagnose anemia. Okay, what else? Yeah? Which swab? Vaginal swab has got no role. And this cervical swab got no role. Now what? What do you think lot of vaginal discharge she has written in the examination? Was it coming from the cervix or the vagina? Now the questions from you will be, what type of discharges you know? What are the organism? And what is the treatment? You will tell 4 types of discharges. You just elaborate on to complete your list, then I will tell you what has to be done.
Discharge in trichomonas vaginalis, homogeneous whitish discharge in case of fatty vaginosis, and
Itching associated with itching. Who discharges associated with itching?
trichomonas and fatty vaginosis.
Candidiasis. Or
Curly white in candidiasis.
and हो गया?
Mucopurulent discharge in
Chlamydia. And from where does discharge come?
from the cervix.
Cervix. Remember that comes. Chlamydia, gonorrhea, all are of the cervix, not of the vagina. They cannot inhabit the squamous epithelium of the vagina. Right? And just hurriedly told me the treatment. Tell me the treatment of this. Do we need to make a slides for these? Can we make a diagnosis?
Ma'am, it can be possibly chronic inflammatory disease.
Which is causing a discharge?
It might be a chlamydial infection.
Which is causing a discharge? Chlamydia will not have this much of discharge because it is a cervical discharge. It will not cause this much of discharge. That is why I tell you the findings which has been given are not right. Okay. So now to tell me the treatment for the same. Trichomoniasis.
Metronidazole.
Okay.
And for bacterial vaginosis, we give metronidazole and doxycycline. And for candidiasis, we give fluconazole and
Any one antifungal you can give. There is no problem. So you need to know. You need to know kit 1, 2, kit 7. All of you know. RTI's kit, colors, number of drugs included in it, indications. This is your PG question. Need PG question. What is there in kit 2? What is there in kit 3? What are the indication? What is there in the kit 6? What is there in the kit 7? What does the grey kit contain? What does the yellow kit contain? What white kit contain? All colors you should be remembering. This is a need PG question. Okay? So, discharge. These are the things which can be asked to you at the undergraduate level. But I am very much worried about this patient, where one history has not been taken by you, and which every MBBS student should know. So much of discharge although not found smelling. Did you ask whether ever she has been screened for what? Why not? What is 90-70-90? agree? 70% of the reproductive age group should be screened by any of the tests till the age of 35 years and to be preferably to be repeated in next 10 years time. What is next 90? Treatment of what? The patients who have been diagnosed by screening should be treated in 90% of the cases. So 90, 70, 90, you can get a short note on it, and the aim of it is to eradication, no, to eliminate the cervical cancer by 2030. By 2030. Okay, so has she been screened?
She has been screened.
Not mentioned. So you should be mentioning the screening has been done for this case. Now if the vaginal discharge is there, she has not been screened, will you like to screen her right now?
Yes, ma'am.
No. With the vaginal discharge, you will never screen. Okay? Treat the vaginal discharge, call her back, and then do the screening for the cervical cancer. Call her after 1 week. Okay? The next question which comes and being very commonly asked, what are the prerequisites which you have to fulfill before taking up the pap smear? How can you screen? This is a full question which can come in your exam. The screening for cervical cancer, I think this is a full question for any of the undergraduate students. Now, the cervical cancer, screening of cervical cancer, its methods. What are the methods?
Pap smear.
Pap smear, number 2.
Biopsy.
What? Biopsy is never a screening test. One of you. Wire. Pap smear wire. Number 3. Always remember, if in MCQ it comes, pap smear, via, villi and HPV DNA testing, you have to exclude the villi, because villi isolated is never a screening test. It has to be done in association with wire. Got it? So क्या हुआ? Pap smear, via, HPV DNA testing. Got it? Perfect. Last question. What are the vaccines available with you? And how many, what all viruses are included? Your PG question. You will never say the answer. You will say bivalent, quadrivalent, monovalent, nonavalent. Okay? What does bivalent contain? 16 and 18. What does quadrivalent includes? 6, 11, 16, 18. And only 2 are responsible for the cervical cancer, that is, okay? 16 and 18. Which is most common in India?